The opioid crisis affecting the region touches people from all walks of life, including one group who are often overlooked in the battle against it, pregnant women. But a local effort is trying to address that. A new program at Cooley Dickinson Hospital in Northampton is designed to help pregnant and postpartum women who are recovering from opioid use. Carolee McGrath sat down with nurse midwife Amy Walker, who's heading up the program, to learn more.
So New Beginnings is a program offering group prenatal care and also a postpartum support group for moms that are in recovery from opioid use. And so what will happen is that when patients come into our care, to obstetric care, they'll be offered to start in the New Beginnings program around 20 weeks or beyond. And they'll come about every other week for group visits during the pregnancy, which will include a 2-hour session. And in that session, we do the regular prenatal care, so checking, blood pressure and weight and checking on the baby and anything else that needs to be covered at that time. But then there's also an hour and a half of time to cover education and also have guest speakers come in like pediatricians, social workers, lactation consultants.
And so are these moms already in recovery? Can somebody join you who, is still using and says, listen, I'm 5 months pregnant and I need help? Like, what do you do in that situation?
Absolutely. So either of those situations, those patients would be eligible to come in. A lot of our moms are already in recovery and maybe on medication-assisted treatment like methadone or Subutex already and coming into our care. But some of our moms are coming in, finding out that they're pregnant and have active illicit use. And so this is a program to offer support so that patients can become sober and maintain sobriety. If someone comes to me with active use, then we have a process of referral to getting them into substance use treatment, which is another goal of this program, is to get more moms who have active use into substance use treatment.
Okay, so let's talk a little bit about the amount that the numbers have shifted since 2004. I was reading a state report that said the number of babies exposed to opiates jumped 500% since 2004 to 2013, which is staggering.
It is. It's a huge increase. And what's not represented in those numbers is that there are other patients who are not using during the pregnancy and maybe not on medication-assisted treatment, so the baby doesn't have any opioid exposure, but they may have a history and are at risk for relapse postpartum. And so, there's a whole other section of the population that is not represented in the numbers with the babies that are exposed.
And so your program, though, does cover postpartum, because I would think, as a mother, after the baby is born, when you're exhausted and when you're stressed out and when the baby is not sleeping or doesn't cry, I think that's where so many moms, no matter who you are vulnerable. How do you help work with them?
So we have a weekly postpartum support group that will be open to any mom who wants to come. And this is specific to moms in recovery. And so we'll be offering support in that way, like a kind of a peer support model, but also with some teaching about focus on how to recognize symptoms of depression, how to teach coping skills for stress management, especially in that stressful time where parenting is so tough in those early weeks and that early year.
Right. I would say definitely in that first year. Talk to us just a little bit about what happens to the baby when they are exposed prenatally, and specifically the neonatal abstinence syndrome.
Right. So neonatal abstinence syndrome is a condition of withdrawal. So when babies are exposed to substances during the pregnancy, and then after they're born, they will wean off of that. And sometimes, if they're exposed to opioids, they will have neonatal abstinence syndrome, which with that, you can have irritable babies, fussy, they might be uncomfortable and have trouble with eating or sleeping, maybe difficult to console because of those things. Sometimes they can have gastrointestinal side effects like loose stools or difficulty gaining weight. It is a treatable condition and it does resolve. So the way that we treat it is, the first thing we do is we teach moms how to take care of their babies. And really evidence has shown that the best thing is to keep moms and babies together in process. We call it rooming in, and we do that at Cooley Dickinson, where moms and babies stay together. The baby doesn't go to the nursery unless there's some other medical reason. And then we teach moms how to do skin to skin with their babies, how to swaddle their babies and soothe them. Those are the things that we do first line. Breastfeeding is also recommended unless there's another reason why we would not recommend it, like active use.
What about methadone? So how does that work with them?
So we recommend that, when moms are on methadone, which is what we recommend for treating opioid use disorder, if we expect that babies may have some symptoms of withdrawal, and we recommend breastfeeding for soothing the baby, and also there's the benefit of the baby may get some of the methadone through the breast milk, and that can soothe their withdrawal symptoms as well.
And that doesn't cause any long-term effects?
Not that we have seen, and using the methadone or the buprenorphine to prevent relapse and withdrawal in pregnancy is the recommended thing, because the biggest risk would be illicit use, continued illicit use.
Right. So I have to imagine that, a mom who comes in who's in crisis and who's really concerned might say, oh my gosh, I don't know how this baby is going to survive. How do you, give a message to parents or to moms and also to grandparents who are concerned about that unborn baby?
Yeah, I think that's one of the hardest things, because moms have a lot of guilt. Even moms that are stable in recovery but are on treatment have a lot of guilt about the symptoms that the baby is going through. But what we try to send is empowering messages to moms about, you're not alone in this. You're doing the right thing, it being in recovery, in treatment for your baby. And this is what we recommend. And, we want to partner with you to teach you how to take care of your baby and to help you be sober and successful.
And tell us a little bit about how the program has been going so far. You have patients already?
Yeah, we have some patients that are involved, and it's been really good. The thing that is great about group is the peer support too. It's not just about me teaching; it's about us all learning from each other and connecting. And I've already seen some connections happening, which is really inspiring and exciting.
That's fantastic. Amy Walker, thank you so much for joining us today and telling us about this program, which I think is going to be so helpful to so many parents out there. Thank you.